In this segment, we're going to review our anatomy, our muscles, their movement, and where we're going to treat. For the purposes of ease, we're going to split the face into the upper face, which is usually the most common treated areas, and then the lower face. In the upper face, majority of your clients, 90% to be precise, are going to come for 3 treatment areas. But let's review the muscles first. Number 1 over here, we have our frontalis muscle. Number 4, 5, and 3, we have our psoas muscle, our corrugator muscle, and our depressor supercilii muscle. Over here at number 6, bilaterally, it's the same. We have our orbicularis oculi muscle. Now these muscles function differently. So our frontalis muscle is an elevator. What it does is it lifts up. When it lifts up, we get those wrinkles across here. These 3 muscles, if you recall from our previous slide, which is our psoas muscle, our corrugator, and our depressor supercilii right here, these muscles, when engaged, they depress, they pull down. And that's why we typically call them the 11s. Over here, we have our orbicularis oculi muscle. And with the orbicularis oculi muscle, if you can imagine, it functions as a sphincter. When engaged, it goes like this, it closes in. And when it closes in, it pulls down, and you have the crow's feet here on the side. Now with the upper face, once you're comfortable and advanced in your practice, you can also treat your muscle right here, which is called your nasalis muscle. This over here, when engaged, it pulls inwards and slightly up, giving you what's called the bunny lines. And that treatment will be here. For the purposes of this section only, we're going to focus on the most commonly treated areas, which is your forehead, your crow's feet, and your 11. Now, regarding your lower face, you can treat several areas depending on what your client is looking for and what they're looking to achieve. Over here at number 12, again, you don't need to screen record this or screenshot it, it will be inserted. At number 12 here, we have our orbicularis oris muscle. What is the treatment that your patient would look for, and what would you be treating here is you would be inserting 2 units, 2 units, 2 units, 2 units here to achieve a lip flip. This is for patients that have a complaint of a small lip and they kind of want more to show in their lip. So you're ever so slightly everting the lip. Additionally, this will help with smoker's lines. So it's going to relax those lines. Now, since we're speaking about the mouth, we're going to also address a gummy smile. When treating the gummy smile issues, you're not treating the orbicularis oris. Here is you're treating this muscle here at number 8. And this muscle is your levator labii supercilii. So if you break it down to simple terms, it's elevating because it pulls up your lip and it connects between the lip and the nose area right here. When you're treating for a gummy smile, you're descending, you're relaxing these 2 muscles so you're not allowing them to elevate, as its name suggests. And you're treating right here or right here. It really depends on your comfort. That we'll discuss later. But typically, it's suggested that you come to the nasal flare, insert right there. You come to the nasal flare, you insert right there, and you're targeting that muscle right here at your number 8. Now coming to the lower portion of your oral area and your lips, we have a muscle over here, which is known as the DAO, which is your depressor angularis oris. Now this muscle, it pulls down, it depresses down the angles, as the name suggests, of the mouth. When treating this area, we have to be mindful and respect the adjacent anatomy because you don't want to go and create a tox effect to surrounding areas and then creating a crooked or irregular smile. Over here, your treatment is going to be 1 centimeter laterally and 1 centimeter below, and you're right here. But as you'll see, we'll demonstrate, you're going to always palpate for your muscle to see where it is, to know for a fact that you're treating the correct area. Another little tip to avoid injecting your muscle, your depressor labii inferior, which is this muscle, number 17, right next to your DAOs, next to 16. So we want to treat this area for that pull down smile, for that pull down, my apologies, not smile, the pull down of the corner of the lips. You want to avoid number 17. Now, how we can do that is you're going to ask your patient to purse their lips. When they engage by pursing, this muscle is activated, so you know where not to go. But typically 1 centimeter to the side, 1 centimeter below, boom, boom, you got that treatment. Now we've addressed your pull down of the muscle, or also known as your resting vitreous. pose down. If you want to treat the dimples in the mentalis, over here, the little dimples, which is number 18, you're going to be treating your mentalis muscle right here. As you can see, this muscle, this area encompasses the same muscle, but it's kind of almost like branched out. So for this treatment, you're going to remember number 17 always. You can have them pursed too. You can identify it, you're gonna come here, and that's going to be your treatment zone. So to better understand what we're treating our patient for, let's discuss very briefly the type of wrinkle we're addressing. The wrinkles that your patient is having is going to be two types. It's either going to be a static or dynamic. A dynamic line occurs when you're engaging the muscle movement and it creates a line. When the muscle is not engaged, that line is not there. Dynamic lines can, however, become a permanent static line. A static line is a line that you'll see, or a wrinkle you'll see, on the face, even with no expression. Usually and commonly, you'll see this at the 11s right here, or at the forehead in the middle. Now, what's the function of your toxin? With the neurotoxin, we're going to treat, it blocks the signal at the neuromuscular junction. Over there, if you can imagine, an impulse is coming from the brain to the nerve to communicate to this muscle to contract, but now you're putting a block here. So this signal is not passing through. That's what the Botox is doing. We're not killing a nerve and we're not killing a muscle. But what happens, if you can imagine going to the gym and you're exercising and you're trying to build your deltoid muscle, it grows larger and larger the more you engage it. Similarly with all your muscles, even the face. The more you're moving this muscle, it gets bulkier and thicker. The more you're chewing, your masseter gets bulkier and thicker, and so forth. When we're blocking this communication, with time, your muscle will thin out and become more relaxed. Piggybacking on this, you have to respect that the skin in itself is an organ. With years of engagement and moving your facial expressions, if this becomes an etched in line and it becomes a static line, when you're treating Botox, we're addressing the movement of the muscle, but your client can still come back and say, hey, I still have this line, what's going on? That's a whole different topic for a different video. So to recap on your neurotoxin treatment, what we're doing is we're blocking the communication of the nerve to the muscle to create that constriction or the contraction of that facial expression. With time, this will relax that muscle in its most relaxed state. That's why you'll see, that's why you'll see those fine lines improve and sometimes disappear. And with time, that muscle will thin out because you're not engaging it as much.